This morning, we're going to hear about how our children and how our early educators, we're going to get grounded in the why of our attendance today. We'll have time for Q&A at the end of the session. So while you're listening and playing with your threads and pipe cleaners, please think of your questions. With that, we are happy to welcome our first speaker, Dr. Walter Gilliam. Dr. Gilliam is the executive director of the Buffett Early Childhood Institute. Before his current role, he was professor of child psychiatry and psychology at the Yale Child Study Center and director of Yale's Edward Ziegler Center in Child Development and Social Policy. He's held several national leadership roles, including board service on the 0 to 3, Child Care Aware of America, the Irving Harris Foundation, First Children's Finance, All Our Kin, and the National Workforce Registry Alliance. In 2023, he was named a senior fellow working with the Bipartisan Policy Center's Early Childhood Initiative. Dr. Gilliam is the co-recipient of the prestigious 2008 Grawemeyer Award in Education for the co-authored book, A Vision for Universal Preschool Education. Sounds like a lovely dream, actually, universal preschool education. His research involves early childhood education and intervention policy analysis, specifically how policies translate into effective service. Dr. Gilliam has led national analyses of state-funded pre-kindergarten policies and mandates, how pre-kindergarten programs are being implemented across the range of policy contexts, and the effectiveness of these programs at improving school readiness and educational achievements, as well as studies on methods to improve early education quality. It's a privilege to have Dr. Gilliam here with us in Alaska. Please join me in welcoming Dr. Walter Gilliam to the stage.
Hello, everyone. Hi, it's great. It's great to be back here in Alaska. I was telling Stephanie earlier, Stephanie could ask me to do anything, and she'd go there, I'd be there, go here, I'd go there, hop twice on one foot. I'd do it. But Alaska is just also such a beautiful place to be, with such wonderful, amazing, warm people that I always enjoy being here among you. So I was asked to talk today about a topic that we've been studying first at Yale, and we're continuing it now that I'm in Omaha at the Buffett Early Childhood Institute, and that's looking at the well-being of those who care for our young children. It's hard to imagine an environment that is well for children that is not well for the adults who are caring for those children, isn't it? It's hard to imagine a young child in the absence of those adults who care for that child. The well-being of our children is highly dependent, I would say completely dependent, upon the well-being of the adults that are wrapped around that child. And so at the beginning of the pandemic, back in 2020, in March, I became concerned about a lot of things. And one of the first things that I'll admit that concerned me regarding like the pandemic and the impact the pandemic might have is whether we would be able to have enough physicians and nurses and therapists and environmental service people and others who work in hospitals and work in healthcare facilities to be able to take care of people during a pandemic if there's no one taking care of their children. You know, how do you keep a hospital open to provide health care if there's no one providing child care for those who provide health care? And so I started working with these scholars who were expert in big data systems. And we stood up within just like about a week's time, a way to be able to look state by state and county by county and municipality by municipality and see how many people there were that work in hospitals and other healthcare facilities where all of the adults in that home are essential health or are essential workers of some sort. In other words, how many of these workers have no one else who would be able to take care of their children at home. And how many of them have young children who are too young to be left alone at home? And by doing this, we were able to then look and see, well, how many childcare spots would you absolutely have to have open and available in different places in order to be able to keep our hospitals open? And then we released that through Childcare Aware of America, and we put it online at Yale. And it got a fair amount of attention because it was early in the pandemic. And as a result of that, $3.5 billion with a B were pulled out of the original CARES package specifically to stand up emergency childcare for essential healthcare workers. Do you remember that? So when we got that through and we got that stood up, the next thing that jumped into my mind was, well, okay, now that we have that, what exactly did we win for childcare providers? The opportunity to go do something that could put them at risk? Because again, bear in mind, at the beginning of the pandemic, nobody knew they called it the novel coronavirus for a reason. It was novel. I mean, nobody knew what to expect out of this. And so we became worried, well, is this even safe what we're asking childcare providers to do, to come to work? Remember, K through 12 teachers were staying at home because we weren't quite sure if it was safe for them to be at work, but childcare providers were coming to work. I can't imagine why it was inherently safer for childcare providers. We just needed them more, I suppose. And that became a concern. And so as a result, we started doing some studies looking specifically at this question of how well are those who care, and trying to be able to determine whether or not coming to work put one at an increased likelihood of being susceptible to catching COVID-19, to having increased complications, for not faring well. And so we were getting ready to start this, there were some other people who were looking at other statistics too, including this one group of researchers who were looking at individuals who had died in the first year of COVID-19, where COVID-19 was listed as the reason for their death. And when the researchers looked at this, they broke it down by occupational type. What is the likelihood per 100,000 of dying if you are this job versus that job versus this other job? And then there was this reporter at Chalkbeat who contacted the original researchers and said, I noticed that you broke out K through 12 teachers. Could you break out childcare providers and early educators? And they said, well, sure, there's a BLS coding for that. And so they actually did some additional analyses to be able to break out specifically early educators. And what they found was that in the first year of COVID, there was 38 COVID-listed deaths per 100,000 employed childcare providers. Compare that to 30 on average for essential healthcare workers. Compare that to 25 across all workers. Compare that to 16 for non-essential workers like I was, who could do my job via Zoom from home. 16 also was the number for K through 12 teachers. In other words, much, much, much higher rate of death due to COVID during the first year of COVID for childcare providers. And they were the ones going to work. Now, what's important to understand about that is that doesn't necessarily mean why it was that they were having an increase. It could have been due to a whole host of different types of reasons. And so we have started a study at that time looking specifically at COVID-19 transmission in childcare programs. And when we started this study, what we were primarily interested in was this very simple question of, does going to childcare, working in childcare, put a childcare provider at greater risk of catching COVID, having COVID complications, being hospitalized for COVID, having severe complications as a result of that COVID? And so what we did was we embarked on a very large study. And in the first wave, we had about 82,000 childcare providers across the United States. In our first analyses, you can see we had a little bit over 57,000. And what we did was we looked at those who were going to childcare during the first few months, those who were staying at home. We also looked at whether or not they had caught COVID-19 and whether or not they'd been hospitalized for COVID-19 and what kind of complications they had from it. And we statistically controlled for a variety of other factors having to do with whether or not they were wearing masks at home, whether they were frequently washing hands, what they were doing in the child care program, what they were doing in their community. We were linking the data also, because we geolocated it, to data that was being collected from Johns Hopkins University at the county level. Remember when Johns Hopkins was doing that and they were showing what the COVID rates were county for county? So we wanted to control also for the amount of COVID in your community, because the more COVID in your community, the greater the likelihood that you're going to come in contact with it. And so controlling for all of those factors, what we ultimately found was this: providing childcare during the first several months of the COVID-19 pandemic did not place childcare providers at a greater risk of catching COVID-19 than just being alive in their community. Which then raises this interesting question. Well, if going to work doesn't place you at a greater likelihood when that work is childcare, and by the way, we were collecting data on what these childcare providers were doing. I had no idea how it was possible to be doing all the things that they were trying to do to keep children safe. I mean, they were disinfecting things 3 times a day. I mean, I was actually less worried about children catching something from a surface than I was accidental ingestion of Clorox, because there was just so much of that happening. And in addition to all of that, they were basically being told to do the opposite of everything they've been taught in early childhood prep programs. So don't do any more family style. Sequester children. Don't have them interacting. Keep them separate. Cohort them. You know, it was a very complicated, difficult time for childcare providers. But in many ways, I think childcare providers, that they were ready for that moment in ways that K through 12 teachers could not have been, because childcare programs are licensed primarily on the basis of health and safety. And I don't really think, yeah, you can woo-woo that. I don't think that enough has been made out of the fact that childcare programs probably had an awful lot to teach K through 12, probably had an awful lot to teach other types of programs that take care of others, because of how much they focus on health and safety issues. I mean, they were really very ready for this moment. And as a result, going to work really did not elevate the risk at all that we could find. Which then raises the question of, well, why was it more likely that they were going to catch COVID-19 and die? And so when we looked deeper into the data, it became clear that there was a handful of reasons that could potentially be causal for that. One, they were less likely to have health insurance. They were living in homes where it was smaller per person in the home, so they had less of an opportunity to sequester somebody who was sick away from somebody else. They were also more likely to be married to, partnered with an adult who also was an essential worker, who was going to work in a place that might not be taking those same level of precautions that childcare programs were. In other words, I don't think it had anything to do at all with the conditions of the work. I think it had to do with how we treat them, how we compensate them, what they're able to afford, their benefits or the lack thereof. It wasn't about the work. It was about how we treat them as a group. So when we were doing some of these studies, we thought that it was important to know what some of the comorbid conditions might be that would make it more likely that a child care provider would get sick or have complications. I'm going to step away from the podium because can you hear me? Maybe I shouldn't step away. Okay, I'll come back. Look. So, how early childhood is that? You know, the early childhood, who are early childhood providers? Do we have any out there they are people who could walk to work, see 3 pebbles in an acorn and call that a day's curriculum, and just carry it into the room. And then, so in the spirit of early educators, I'm carrying this around with me right now. So you can see some of the health conditions here that we had found. And one of the things that we'd also found was that, and this is the reason why it's bolded, moderate to severe asthma was reported at a rate about 10-20% higher than the general population for women in America. Why might that be? Why might early educators have a higher rate of asthma? Don't be shy. Maybe during the pandemic, maybe cleaning products. What else? Respiratory illnesses? Yes. What else? That's an interesting kind of point, because if it's environmental, and it's in the child care program, then it's not only early educators, it's also babies and children who are breathing the same air as the early educators, or it could be their environment at home. I mean, it certainly raises a lot of questions of whether it's because early education programs are not only just figuratively in basements, oftentimes they actually physically are in basements where there's more mold and allergens and things like that. But it's also possible that it's because we don't pay them well enough to live in areas and communities where there's going to be less pollutants in the air, where there's going to be more of an opportunity for their home to not have these allergens in there. And so one of the things that we're contemplating right now is some additional studies specifically on air quality and early care programs compared to the homes in which they live and the communities in which they live, to try to understand. Because anytime you take a workforce seriously, and any time that you care deeply about a workforce, you should care enough to know what are they most at risk for, and how do we study that to keep them safe? Because the most important element to the success of an early care and education program is that adult that's in there taking care of those children every single day. And it is our job collectively as a society to keep them safe as they keep our children safe. So depression and stress, we use the Center for Epidemiological Studies depression scale, and we use the PSS as measures of stress to be able to see what the depression levels, this is diagnosable levels of depression at the beginning of the pandemic, and then a couple of years into it, and you can see how it's been increasing. There's some recent evidence to suggest that those numbers may be coming down now. But even if they come down to baseline, it's higher than what's typical in the United States. As a group, early educators have more mental health concerns. And I think in many ways, the reason why is because they carry the stress of all the families and the children that they care for. Children, like all humans, have a way of putting all the stresses of their families and their own lives and their communities in a backpack, coming to school or the child care program and dumping it onto the table for the child care provider to care for. And some of the times that child care provider may be on her last nerve too. And I think that's largely what we were seeing here with this. We also saw that depression and stress were highly related to pay security, not just pay, but also how likely it was to get paid during the pandemic. Now, bear in mind, some programs were sporadically opening and closing, and many people who work in early care and education, they're not salaried workers. The program isn't open, they don't get their hours. They don't get their hours, they don't get their pay. And so whether they were going to get paid or not was highly variable. And what we found was that the more variable the likelihood that they were going to get paid on the basis of whether the program was opening and closing and things like that, the higher the levels of stress and the higher the levels of depression. I mean, that makes sense. There was one group for which we did not see that relationship, that more variability didn't lead to more stress. Can you guess what that group was? Early education directors. They didn't show that. And the reason why, when you look closer at the data, was this: they couldn't get more stressed out. It didn't matter what was happening. Their stress levels were through the roof. And there was just like no ceiling room left. And I think it makes sense, because whenever something bad happens, it's the early education director that's going to have to give that news to people they care about, people they love, people they work with every single day. It was a hard gig to run an early care and education program for the last 4 years. Not that it was easy before then, and not that it's easy now. Impact of COVID during the first year of the pandemic, 3 months into it, 35% unemployed, not just not working occasionally, unemployed. Periodic closures for over half of them. How many people are familiar with the Daphne Bassock study? It was a study that was done in Virginia, where they had $1,500 from PDG dollars, preschool development grant dollars, and they were able to then use that to supplement the pay of early care and education providers. And so they did this one random controlled study where they randomly assigned some to get a $1,500 pay bonus if they stayed working in the field for another year. And what they found was that it reduced turnover from 24% in the control group who didn't get the $1,500 to stay to 13% for the group that did. Turns out retention bonuses actually help. $1,500 made a difference. That's a 46%, almost a half reduction in the relative risk of leaving your job because you're not feeling like you're paid enough. Now, they did another study where they, instead of looking at $1,500 just given once or not at all, they said, well, what would happen if instead of giving it once at the end, so you have to stay for, say, 9 months, and then we'll give you $1,500. What if instead we would give you $500 every 3 months? After 9 months, it's still $1,500, right? Which one do you think would work better? And that was their question. So what do you think would work better to keep people employed in early care and education for 9 months more? Would it be, hey, you have to stay the full 9 months and then we'll give you $500 at the end? Or would it work better to give them, or we'll give you $1,500 at the end? Or would it work better to give them $500 every 3 months? $500 every 3 months. Now, a lot of my friends are economists, and I know that there were some economists that were now many economists, my economist friends would say, oh, you gotta make them wait till the end because that's how an incentive works. You make them wait until the end and that will increase your, and I think that makes a lot of sense if it's an incentive. And bear in mind that an incentive is something you don't need, but you want. Now, if you need it, that's not an incentive anymore. That's just maintenance pay. And maintenance pay worked better than making them wait until the very end to be able to get the full amount. And I think that to some degree makes sense when you understand the field very well and how poorly they're paid. So we did this one study where we had about 25,000 in the sample across the United States, and we basically auctioned off how much money would you need? And so the question was basically something like this. A lot of fields offer retention bonuses for people who stay. And we only gave this question to people who actually had either left the field or were contemplating leaving the field. And then depending on whether they're contemplating or actually had left the field, we said, if we were to give you, or if your program were to give you $500 more to stay, would you agree to stay for another year? And if they said yes, then they went on to the next section of questions. And if they said no, then the next question in the survey was this: well, what if it was 1,000? And if they said yes, they went on to the next set of questions. And if they said no, then the next question was, well, what if it was 1,500? Because basically what we did was we just tricked Qualtrics into auctioning off. What incentive will work for you? And what we both basically found is that you could get the same level, but by the time that you were a couple of years into the pandemic, the going rate was about twice as much. But you could still, instead of 1,500, now you're going to have to give them about 3,000 to be able to get the same relative impact. But in the end, paying people more will keep them in their job longer, because these are not people who go into early care and education because they want to make a bunch of money. They go into it because they love babies. And they love children, and they love caring for other people, but they also have to make ends meet. And so if you can just help them out just a little bit, they'll take you the rest of the way, and they'll stay in the job. And that's ultimately what we were finding with this. We also asked some people about whether or not they had been exposed to aggression in their regular life or at work, and whether or not any of that had a racialized component to it. And so when we asked this kind of question, ultimately what we found was this: about 29% of our early care and education workforce across the United States was reporting yes. During the course of the pandemic, about at this point, a couple of years into it, they had experienced aggression towards them, either directly or vicariously, because it was towards somebody that they love. And you can see what the rates were and who was reporting the highest levels of experiencing this. Now, bear in mind that when we're talking about the early care and education workforce, we're talking about a workforce that is mostly women. And unfortunately, women are oftentimes the targets, the victims of domestic and community violence. And in many communities, we're talking about disproportionately women of color, who are also disproportionately the victims and the targets of aggression and violence. And so again, if we care about a workforce, it is important for us to understand who is that workforce, what are they most likely to experience, and how do we protect them as they protect our children. And I would contend that we can't do that until we know who this workforce is and start making logical predictions as to what kind of stresses are they likely to experience in their life, and start studying those so that we can understand how to protect them.
So you can see here in terms of racialized aggression, what they were experiencing, whether they were the target directly of racialized aggression. And what we found here was this. When we looked at whether or not race predicted increases in depression or stress, we didn't find any relationship whatsoever. But if we looked at race, and we also included an interaction term of being exposed to racialized aggression, then we did find a relationship in that interaction term. And so that's a statistical way of basically saying we did not find any relationship whatsoever between race and increasing mental health stress. But we did find a relationship between the experiences of racism, depending on your race, and increasing mental health concerns. In other words, it wasn't the race that was driving it. It was the racism that was driving it. That's what we've ultimately found with that. And again, I'm contending that if we care about a workforce, you have to understand who they are, what are the likely stresses that they're going to be experiencing, and if we don't take that into account, then shame on us for not caring enough about those who care for our children. So what about the whole child professional? How many people are familiar with the term the whole child? It's very commonly used. It's about a 95-year-old term. It was first introduced in a White House report on children, and it was talking about taking care of the whole child. I think it's time for us to also be thinking about taking care of the whole child professional too. That again, if we care about children and the well-being of children, we have to care about the whole person who is taking care of that child. And that whole person is a financial person, but it's also a person who experiences stress in their everyday life. And it's also a person who sometimes might be overly exposed to the potentials of violence and stress in their communities. And we have to take that into account too, if we fully care about the children that they're caring for. How well are our young children? So here I'm going to shift gears a little bit and talk about some of the data that we were collecting at the same time in the same surveys directly from these early care and education providers about their young children. You can see here, we asked them at the beginning of the pandemic, compared to before the pandemic, would you say your children in your classroom are more externalizing, meaning acting out? Aggressive, defiant, oppositional. 22% said, yes, that's true for half or more of the kids in my classroom. 42% said, yes, that's true for a few of the children in my classroom. Added together, 64% of the teachers, the early educators in their classrooms were saying, yes, the children in my classrooms were more acting out than before the pandemic. Now, more acting out, 22% being that's true for half or more of my children, 42% meaning that's true for less than half. Now you can see for internalizing, that's shy, withdrawn, clingy, teary. You can see what the rates are there. And then somaticizing, that's a term for like the way in which young children and all of us can sometimes hold stress in our bodies. Stomach aches that don't have any particular cause, headaches that don't have any particular cause, won't eat, eating a lot more than frequent, won't go down for a nap when they used to be able to go down for a nap, renewed bedwetting challenges, soiling challenges, all the way in which stress can sometimes show up in the body. And even in those instances, increased rates of that. So what about then a couple of years later? Well, a couple of years later, the rates were higher. As early care and education programs were enrolling more and more children into them, we were finding more and more children who were experiencing more stress in their daily lives. And that stress they were then bringing into the classroom. And then the early education provider, who was already stressed out, has to find a way to be able to deal with that. And there are very few things more challenging when you're stressed out yourself than having a classroom of 16 children and a handful of them cannot go down for a nap. I mean, that is a very stressful. About the only thing more stressful than that is the program has closed an hour ago and the parents still are not here. That's also pretty stressful. You know, all of these things are ways in which then our early care and education providers then are having additional stress brought into them through the vector of the children who are also experiencing stress within their communities. Teacher stress, we also know from earlier research that I was doing before the pandemic, highly predictive of expulsion. The more stressed out a teacher is, the more likely that a stressor in her classroom might get kicked out of that classroom. And so I would have expected that as stress levels go up higher with more children and stress levels in more providers go up, the likelihood that a child is going to be expelled from that program also increases probably exponentially. And in fact, with some recent data that we don't have it published yet, that's basically what we're finding, that for a while, expulsion rates were going down, and there was a lot of things that states were doing to try to bring those expulsion rates down, but now they're going back up. And there's a bit of a free market economic understanding, I think, that one can apply to this. Right now, we have in many early care and education programs more families that could utilize the care than we can find staff to provide the care. And under a condition such as that, it can sometimes be difficult for a director to make the decision to hold on to a child if that director feels that holding on to that child and seeing that child through these challenging times might mean losing a provider and then having to not take 10 more children because of the requirements to have enough providers to take care of the children. And so under those kind of conditions, expulsion rates might go up much higher. You'll also see, if you were looking for Alaska there, that you can't find Alaska. We didn't have enough data in that particular wave of analysis to be able to look at it specifically within Alaska, but I'd love to do that. In the states that have a star next to them, the red star basically means they haven't done anything at all in the past several years. Legislatively or policy-wise to reduce expulsion risk. And so essentially what we're finding there is the states that don't do anything to try to reduce the risk, those are the states that have the biggest rebound in terms of children being expelled from preschool programs. We asked those who had left the field. So we had about 3,724 that had left the early care and education field, what their top reasons for leaving the field were. And you can see what those are right there. Up at the top, low pay, not enough respect, lack of benefits, challenging behaviors comes up pretty high too. We also know that early childhood mental health consultation is a way to be able to reduce the likelihood that children are going to be able to have challenging behaviors at such a level that that child might have to be expelled from preschool programs. We know this through statewide random controlled trials that we've conducted. And yet at the same time, many childcare programs don't have access to somebody who can provide mental health supports, either to the provider or to the children in that provider's care. You can see here on request access to mental health consultation versus regular access based on whether the program is a Head Start, early Head Start in the schools, child care centers. During the course of the pandemic, you can see that the access to mental health consultation did increase in programs that were primarily serving children of color. However, before we get too excited about this graph, this is the way that a lot of folks like me will show a graph. And you can see on the left, the scale goes from 0 to 10%. And you can see that there's a bit of a difference there because the way in which the graph is presented can highlight that. But if we actually show this graph a little bit more honestly and turn that left from 0 to 100%, it looks more like this. And that's really the real story. The real story is we could pat ourselves on the back on an increase, but the real reality is most people don't have access to mental health consultation. That's a luxury in a lot of programs. But I think that it should not be a luxury, that every early care and education program needs and deserves mental health supports infused into it in order for that program to be able to provide the supports they need to be providing to those children and families, but also to support the mental health of the provider herself or himself in that program. I'm going to give you some preliminary results that we have from military families. There's military bases here in Alaska, right? A fairly big one, not too far, right? Oh, I see some applause for the military. In full disclosure, that's my nephew there. His name is Jordan, and that's a little Elliot there that they're holding. So we did have quite a few people in our surveys and studies that were providing care on military bases. And we also asked them, in addition to whether they were serving on a military base, providing childcare, are they still doing that a year later? And nationally, about 15% of them weren't providing early care and education. And you can see for the off-base programs, that rate was about the same. But for on-base, because of transfers and things like that, there's a lot more turnover in terms of who it is that's actually providing the care on those programs. We asked them, too, what their main reasons for leaving the field were, and you can see that the reasons were fairly similar. We also asked them about the pay. And this is what our military child care providers had to report. Many of them weren't making enough money to be able to pay bills, or they weren't making enough money to even be able to afford food for their own family. And that was some of the concerns that they were reporting. We asked them questions about the stress and the behaviors of the children in their care. And you can see that many of our child care providers providing care to military families were reporting that the children were experiencing more stress and more acting out behaviors than what you typically find across civilian child care programs. That's noticeably higher. And in addition to that, you can also see that if they were on base, they actually had fairly good access, at least fairly good compared to the general population, to mental health supports. But if they were off base, they had even less access than what you typically find across the United States. In other words, child care providers exist on base and they exist off base in communities. And if they're on base or off base, they're probably dealing with an awful lot of stress, because military families experience a lot of stress. We all watch the news, but our military families watch it differently. And that stress has a toll, and it's one that they have signed up for in order to protect us, and their children will experience that. And if they are on a base, they probably have at least more access than typical childcare programs to mental health supports. But if that's an off-base childcare program, chances are good that in the community in which they're located, it's probably less than what they would find in other communities around them. And that's what we were ultimately finding from that. I will end with this one thing, and that's that we have been looking at this one issue that's been bothering me for quite some time. How many people are familiar with the educator expense deduction? Okay, so for those of you who might not be knowledgeable about that, if you're a K through 12 teacher, then for the last 20 years, you've been able to deduct a certain proportion of money that you spend that's unreimbursed on your classroom from your taxes. You don't get reimbursed for it, but at least you don't have to pay taxes for it. So in other words, if you spend money and you're a K through 12 teacher and you spend that money on classroom materials, you don't have to pay taxes on it. And that's an above the line deduction. You don't even have to itemize. If you're a K through 12 teacher, you could just say and report that you spend this money on your own professional development, on classroom materials, or anything else like that that's necessary for a K through 12 teacher to be able to provide education, and you don't have to pay taxes on that. At first, it was a $250 max, and then they increased it up to $300. If you're married to an educator too, and you're both educators, then it's $300 each, so it's $600. And that deduction has been there for quite some time. And it's available to K through 12 teachers, and it's available to principals and assistant principals and guidance counselors and PE teachers. And it's available to assistant teachers. It's available to a lot of other people in the classroom too, K through 12, but not early educators. Early educators are not allowed to take the deduction. And in fact, in Omaha, we were writing a blog on this and found, because you can find a lot of instances of this, a school, an elementary school, where there's a kindergarten teacher who's eligible for the deduction right across the hall from a preschool teacher who's not eligible for the deduction, even though they're exactly the same credential. And why is that? What would be our guess as to why early educators are not allowed the educator expense deduction? Were they being singled out? I don't think so. I don't think we suffer from people trying to target early educators. I think we suffer from neglect people not even thinking about it and using the term K through 12 as if it's going to encompass everybody in the school building when it does not. And there's an awful lot of early educators that aren't even in a school building. They're in our childcare programs. They're in our Head Start centers. And some of those are attached to schools and some of those are not. I would contend that they should all be eligible for this kind of a deduction. If they are subsidizing our early care and education system out of their own pocket, they shouldn't have to pay taxes on it, right? So, okay, thank you. So anyway, what we did was we add some questions into the survey. Over the past year, have you spent money out of your own pocket on X, Y, and Z? And the X, Y, and Z were the things specifically in the law that K through 12 teachers are eligible to count as a deduction. And what we found was that about 90% said, yes, I do that. On average, about $200 per year. What's interesting to me, and you guys would be the expert on this, Alaska had the lowest rate of teachers actually reporting that they were spending money out of pocket. And I don't know exactly what to make out of that. It was 64% instead of the 90%, and it was a lower amount of money on average, 123, and it might have been just due to the fact that maybe they just don't have the money to spend. Because again, when you're talking about this kind of a deduction, essentially you're talking about a workforce that's fronting the money. I mean, they're not getting reimbursed in the moment. They're not even getting reimbursed at all. I mean, they're essentially fronting the money. And if they don't have enough money to front that money, then they're not going to be able to do that. And maybe they would if they knew that they could get a tax deduction for it, maybe. So anyway, ultimately what we found here was this, that our early educators across the United States were also spending money out of pocket and not getting reimbursed for it. During the pandemic, there was the CDC said that K through 12 teachers should be prioritized for the vaccine. Remember that? And then they also said that you should do that for childcare providers too. But only about 10 states actually prioritized K through 12 teachers, and of those 10, half of them forgot to include early educators. Oftentimes early educators are just simply forgotten in this. And so that's why I'm starting to work with some folks to try to see whether or not we can get a technical fix on this bill to be able to include early educators. Because thank you. Because clearly this has to be an oversight, because no society would be so immoral as to not include early educators in something like this. I'm going to end with this. And this is how I oftentimes end my talks. How much we truly care for our young children can be measured by how much we care for those who care for our young children. And that essentially a young child's cup is filled to the degree that some caregiver's cup is overflowing. And if the cups of caregivers are not overflowing, then our children aren't being cared for as well as they could and should be. And then shame on us. So I'm going to say thank you to all of these folks here, including the National Workforce Registry Alliance, who helped us with all the data collection. You're going to hear from Ann later on about the economic report. We're excited about that too. And I now have some time, I think, for a couple of questions. Look, that's, and the sign said time for questions. So I did it right on time. So are there any questions, any yahoos? You forgot to also mention this? I don't know how we're supposed to be handling this. We have mic runners. Okay.
Yeah. Hi, Walter. I saw you a couple weeks ago at the Childcare Aware of America conference at Leadership Institute, and you were talking about the push nationally for the decrease in regulations. And you had some really great nuggets of how that impacts childcare providers and children. So if you have a couple of those that you'd like to share, I think it was impactful.
Oh, thank you. Thank you for that. The comment is about a presentation that I was giving at Childcare Aware of America that was specifically about the push that a lot of people have to deregulate. And one of the deregulation areas that's being pushed the most is making it to where childcare providers and early educators could serve more children. And And then the other one is to make it to where you don't have to have any particular credentials in some places to actually be an early care provider. And if you're 14 years old and you're living in the Dakotas, then you too could be a child care provider. And those are the two main areas in which those are being considered. Now, why would that be considered so much now? I mean, the stated reason is that we don't have enough early educators. And so we want to be able to make sure that we have enough early educators by allowing them to take care of increasingly more children, or to be able to make it to where just about anybody could qualify as an early educator, even if they don't really have any particular training in how to care for children. Whenever a decision is made, it's almost always a choice between one way of thinking about it versus another way of thinking about it. And so when we choose to say, how do we deal with this challenge by making it to where more educators can care for children, then what we're ultimately doing is we're choosing to not say, how do we finance this field well enough that those can afford to actually be. This is not a solution. This is an avoidance of the main issue. And the main issue is that we don't pay early educators enough for them to be able to make this a viable living. And so it's important upon us to remind people that when societies are making this kind of a decision, or when they're saying this, it's because they don't want to say the other thing. And the other thing is that early educators need to be paid better. Now, in terms of some reasons why we should not be considering increasing ratios. One of them is there is some data that suggests that in child care programs, especially home-based child care programs, where there has been an infant death in the program, 10% of those programs were over capacity at the time of the death. So that carries a real world implication to it. We also know that one of the best predictors of teacher stress, provider stress, is ratios. And so if the problem is that we don't have enough early educators, and that early educators are leaving the field because they're not paid well enough and they're stressed out, doing things to make them more stressed out is probably not a good long-term solution. It may feel good in the moment, but it will not take us to the promised land later down the road if we end up running people out of the field because of that. And so as a result, if you want, go online to the Buffett Institute, you'll see that there's a policy brief, and we lay out 4 main reasons why this would really be a bad idea. It would endanger children. It would endanger children's health and safety and well-being and their education. And it would also just probably be counterproductive and take us right back to where we started from at the beginning. When you say last question, does that mean that was the last question, or the next is the last question? This one now. I'm sorry. Okay. Well, thank you very much. I'm delighted to be here and looking forward to the rest of the presentations.